In this video by deckplate, we will understand the VA rating for varicose veins, cold injury, Raynaud's disease, erythromelalgia, angioneurotic edema, Thrombo-angiitis Obliterans, peripheral arterial disease, and aneurysm. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. When dealing with vascular and related conditions, the VA assigns ratings based on the severity of symptoms and their impact on daily life. Here is a detailed overview of the ratings for several conditions. Aneurysm, any large artery. Diagnostic code, 7111. An aneurysm in any large artery is a serious condition where the artery wall weakens, causing an abnormal bulge or ballooning. If the aneurysm ruptures, it can lead to severe internal bleeding. Symptomatic or post-surgical correction period, rating 100%. Following surgery, evaluated under diagnostic code 7114, peripheral arterial disease. Note: 6 months after surgery, a mandatory VA examination determines the appropriate disability rating. Any change in evaluation based upon that or any subsequent examination shall be subject to the provisions of Section 3.105e. Aneurysm, any small artery, diagnostic code 7112. An aneurysm of any small artery involves the dilation or bulging of the artery wall in smaller blood vessels. Asymptomatic, rating 0%. Note: if symptomatic, the condition is evaluated based on the affected body system. Following surgery, residuals are evaluated under the relevant body system. Arteriovenous fistula, traumatic. Diagnostic code 7113. An arteriovenous fistula, traumatic, is an abnormal connection between an artery and a vein that is typically caused by injury. With high-output heart failure, rating 100%. Without heart failure but with enlarged heart, wide pulse pressure and tachycardia, rating 60%. Without cardiac involvement but with chronic edema, stasis dermatitis, and either ulceration or cellulitis. Lower extremity, 50%. Upper extremity, 40%. Without cardiac involvement but with chronic edema or stasis dermatitis. Lower extremity, 30%. Upper extremity, 20%. Peripheral Arterial Disease. Diagnostic code, 7114. Ankle brachial index less than or equal to 0.39, ankle pressure less than 50 mm of mercury, toe pressure less than 30 mm of mercury. Or transcutaneous oxygen tension less than 30 mm of mercury, rating 100%. Ankle brachial index of 0.40 to 0.53. Ankle pressure of 50 to 65 mm of mercury. Toe pressure of 30 to 39 mm of mercury. Or transcutaneous oxygen tension of 30 to 39 mm of mercury, rating 60%. Ankle brachial index of 0.54 to 0.66. Ankle pressure of 66 to 83 mm of mercury. Toe pressure of 40 to 49 mm of mercury. Or transcutaneous oxygen tension of 40 to 49 mm of mercury, rating 40%. Ankle brachial index of 0.6 to 0.79. Ankle pressure of 84 to 99 mm of mercury. Toe pressure of 50 to 59 mm of mercury. Or transcutaneous oxygen tension of 50 to 59 mm of mercury, rating 20%. Evaluate residuals of aortic and large arterial bypass surgery, or arterial graft as peripheral arterial disease. Each extremity is evaluated separately and combined under Section 4.25, with the bilateral factor Section 4.26, if applicable. Thrombo-angiitis Obliterans Berger's disease. Diagnostic code, 7115. It is a rare disease of the arteries and veins in the arms and legs. It involves inflammation and clotting of small and medium-sized blood vessels, leading to reduced blood flow, tissue damage, and in severe cases, infection and gangrene. Lower extremity, rated under diagnostic code 7114. Deep ischemic ulcers and necrosis of the fingers with persistent coldness of the extremity. Trophic changes with pains in the hand during physical activity, and diminished upper extremity pulses, rating 100%. Persistent coldness of the extremity. Trophic changes with pains in the hands during physical activity, and diminished upper extremity pulses, rating 60%. Trophic changes with numbness and paresthesia at the tips of the fingers, and diminished upper extremity pulses, 40%. Diminished pulses, 20%. These evaluations involve a single extremity. If more than one extremity is affected, evaluate each extremity separately and combine under Section 4.25, using the bilateral factor Section 4.26 if applicable. Raynaud's syndrome. Diagnostic code 7117. It is a condition where small blood vessels in extremities like fingers and toes spasm in response to cold or stress, causing color changes, pain, and numbness. 2 or more digital ulcers plus auto-amputation and history of attacks, rating 100%. 2 or more digital ulcers and history of attacks, 60%. Daily characteristic attacks, 40%. Characteristic attacks 4 to 6 times a week, 20%. Characteristic attacks 1 to 3 times a week, 10%. Note: characteristic attacks involve sequential color changes of the digits with pain and paresthesias, triggered by cold or emotional stress. Angioneurotic edema. Diagnostic code 7118. It is a condition characterized by sudden swelling beneath the skin, often around the eyes and lips, and sometimes affecting the throat, which can lead to breathing difficulties. Attacks without laryngeal involvement, lasting 1 to 7 days, occurring more than 8 times a year, rating 40%. Attacks without laryngeal involvement, lasting 1 to 7 days, occurring 5 to 8 times a year, rating 20%. Attacks without laryngeal involvement, lasting 1 to 7 days, occurring 2 to 4 times a year, rating 10%. Erythromelalgia. Diagnostic code 7119. Erythromelalgia is a rare condition characterized by episodes of burning pain, redness, and increased temperature in the hands and feet, often triggered by warmth or exercise. Characteristic attacks occurring more than once a day, restricting most routine activities, rating 100%. Characteristic attacks occurring more than once a day, not restricting most routine activities, rating 60%. Characteristic attacks daily or more often, responding to treatment, rating 30%. Characteristic attacks at least 3 times a week, responding to treatment, rating 10%. Note: attacks involve burning pain in hands or feet with increased skin temperature and redness. Varicose veins. Diagnostic code 7120. Varicose veins are swollen, twisted veins visible just under the surface of the skin, typically in the legs. Evaluated under diagnostic code 7121. Post-phlebitic syndrome of any etiology. Diagnostic code 7121. Massive board-like edema with constant pain at rest, rating 100%. Persistent edema with subcutaneous induration, stasis pigmentation or eczema, and persistent ulceration, rating 60%. Persistent edema with stasis pigmentation or eczema, with or without intermittent ulceration, rating 40%. Persistent edema, incompletely relieved by elevation, with or without stasis pigmentation or eczema, rating 20%. Intermittent edema or aching and fatigue, relieved by elevation or compression, rating 10%. Asymptomatic palpable or visible varicose veins, rating 0%. Cold injury residuals. Diagnostic code 7122. Arthralgia, pain, numbness, or cold sensitivity plus 2 or more additional symptoms, rating 30%. Arthralgia or other pain, numbness, or cold sensitivity plus 2 or more of the following: tissue loss, nail abnormalities, color changes, locally impaired sensation, hyperhidrosis, anhidrosis. X-ray abnormalities. Osteoporosis, subarticular punched-out lesions or osteoarthritis, atrophy or fibrosis of the affected musculature, flexion or extension deformity of distal joints, volar fat pad loss in fingers or toes, avascular necrosis of bone, chronic ulceration, carpal or tarsal tunnel syndrome, rating 20%. Arthralgia or other pain, numbness, or cold sensitivity plus 1 of the following: tissue loss, nail abnormalities, color changes, locally impaired sensation, hyperhidrosis, anhidrosis, X-ray abnormalities, osteoporosis, subarticular punched-out lesions or osteoarthritis, atrophy or fibrosis of the affected musculature, flexion or extension deformity of distal joints, volar fat pad loss in fingers or toes, avascular necrosis of bone, chronic ulceration, carpal or tarsal tunnel syndrome. Rating 10%. Note: evaluate each affected part separately and combine ratings in accordance with Section 4.25 and 4.26. Soft tissue sarcoma. Diagnostic code 7123. Soft tissue sarcoma of vascular origin, rating 100%. Note: a 100% rating continues for 6 months after treatment cessation, then re-evaluated based on residuals. Raynaud's disease. Diagnostic code 7124. Characteristic attacks with trophic changes, rating 10%. Characteristic attacks without trophic changes, 0%. Note: trophic changes include skin and nail changes. This section evaluates primary Raynaud's. Thank you for watching this video. Please don't forget to subscribe and like our videos.